So for those familiar with the RPI and our training, we really focus a lot on having great procedural skills. And so I want to digress back a little bit more to you're dialing your marketing, you're getting those leads, you're getting someone sitting in your office who now is coming to you. Now they're sitting in your office and you have to kind of go through your whole diagnostic plan, why you're going to do this, and kind of give them kind of what you would like to help them with to get them the outcomes that their friend had. And there's a lot of tools that I've learned now over the last 15 years on how to educate patients. You know, $10, Walmart, you get the whiteboard, dry erase, right? So the patient will come in, say, I went through the history, the physical, I got the diagnostic exams, my ultrasound, x-ray, and now I've got to take this all together, and I've got to talk to my patient here and let them know, here's what we're going to do to you. Well, remember that surgery you told me about you had 3 or 4 years ago? We talked about how the studies with that surgery show that meniscal surgery is no better than placebo at 1 year, because what happened is the old meniscal procedures would be they'd take out this meniscus. When they took out that medial meniscus, which is where that pain is when I push on that, remember that pain? They took out the meniscus. So as you start coming to our conferences, we're going to talk a lot about how to integrate AI to make your life easier. So what I'm doing is I'm talking, as I'm explaining to the patient, my phone is creating a beautiful chart for me and everything else. So as I'm putting some keywords in here, I'm putting these also for my AI to listen and create a great chart. So the number one diagnosis you have is if you have knee osteoarthritis. That is the loss of that cartilage, with the risk factor being possibly the surgery, the wear and tear, those old injuries you had. We do meniscuses every week, and there's probably about an 85% chance you won't need surgery in this one, so I think that's good stats for you. A lot of this can be fixed with some simple physical therapy, so I'm probably going to get you a physical therapy consult, which we'll talk about in your plan over here in a second. So you've got some patellofemoral tracking issues, patellofemoral syndrome, which is actually a little bit of wear and tear on your kneecap. What we're finding here is that knee pain, knee degeneration is often related to the nerve structures that are around. If I don't talk about your knee pain, about 20% of knee replacements are done, but the doctor never pushed, or I pushed on you about 10 minutes ago. Those are nerves. When I also tested that ligament, by the way, you got some instability of this ligament. When we talk about the treatment plan, we're going to talk about that as well, because there's things we should do about the instability you're having. Let's look at the options that we have here, because I know you told me at the beginning, you said ideally you'd like to avoid surgery. If you need surgery, we can talk through that and talk about the options as well, but I think there's a good chance we can get through this. I can decrease your pain. And I know you want less pain because you told me about that trip you have coming up, and you want to hike, and you're going to go to Europe, and you want to have some fun. The other thing, though, is, you know what if there's something we could do that actually helps to heal and repair? The one thing that I've been finding here, and I don't do a lot of high-dose steroids anymore, cortisone steroids. So a lot of the research is showing if I put steroids into your joint, it starts to erode this beautiful cartilage that we want to preserve. So we won't do any high-dose steroids, but I'll talk about some other things we can do to decrease your pain, so you can do that marathon next week without a lot of pain. So if we don't treat the nerves, I'm not fully going to be able to treat your pain. At a super dilute concentration of dextrose, I can take care of your pain, both in your nerves and in your joints. So a simple intra-articular injection of dextrose, I can put dextrose around these nerves, so I can put dextrose in your joint. It's resetting your nerves, it's giving nutrients, dextrose is a sugar, back to that nerve to reset your pain patterns again. Yes, I know this is what you want your friends had, but it's going to at least get you moving, get you feeling better, so when we do some physical therapy, you can get your stuff done without all that pain that's holding you back. So I need to talk to you a little bit more about the healing side. I'm going to label them number 1, number 2, number 3, number 4, so you know your treatment options. There's some research on why we'd pick one or the other, but bone marrow might be a better option for you. And usually when we do these, by the way, we combine both of these. The stem cells, which is like a seed, with the fertilizer. That's your best chance of getting some stuff to grow there. The other thing that I should probably talk to you about is I always like to talk about risk factors, because if we don't discuss risk factors, we are never going to get the outcomes that we want. So one of the top risk factors for you, you said you're 55 years old, you're female, you said you are through menopause, is your hormones, right? So if we don't address this hormone issue, we're not addressing one of the main reasons you're having pain, the fatigue you talked about. A lot of this is your hormones, so if you want to, I'll get you a consultation with what's called functional medicine. If we're trying to use these guys to grow, this will help you grow a little bit better. I'll give you a list of some supplements. If you don't have them on the way out, of course, we have them in the lobby, so you can pick them up there too. When you went to orthopedics, did they talk to you about an unloader brace? They did it. You start walking, you're going to shear down those new little cells there, but with the unloading brace, it opens up the joint. To open that up so we can do what the research is showing us and create healthier cartilage in there. So I definitely want to answer some questions and kind of work through this and kind of come up with a plan to kind of see what you're really looking for. It's worth having that at the end, because then what they do is they go to the front desk, and you've talked about, and you may not have all these services. I'm going to maybe have one of my salespeople do a quick follow-up call. Hey, I know if you start putting some of this stuff into your plans too, it's going to optimize the outcomes in your patients, but also optimize the outcomes in your businesses too.